The ACS COVID Registry has an overreaching priority to collect important clinical data on both surgical and non-surgical patients with COVID-19. Our hospital is participating in this registry because we recognized when the registry became available that it was a great opportunity for our quality colleagues to leverage some unique skills to help during the COVID-19 pandemic. Through our quality program, we already had the expertise, experience, and process in place to be successful for the registry. So in fact, our NISQIP team of SCRs have taken the responsibility of clinical chart abstraction for the ACS COVID-19 registry. And we have found already that the data entry portal has been easy to navigate with a logical flow that makes sense to us. And the resources provided by the college have been really helpful. So we've been really pleased so far with our participation and the flow of the registry. The data that we are collecting as part of this registry was developed through the input of experts who are on the front line, who've advised as to what key variables should be collected. And it's also based on the availability of the relevant information in the medical record. So our experience so far has been things like different lab work, patient comorbidities, symptoms, have all been kind of intuitive as an SCR to be able to find our way through the chart and gather. And one thing I also want to point out is that this kind of goes beyond what maybe administrative or coding type data could capture. We're actually scanning through the chart to look at kind of the real clinical picture of each patient and then gathering the data based on that patient's experience. The COVID-19 registry is for both surgical and non-surgical patients who have the COVID-19 diagnosis. So any patient who has that diagnosis can be captured in this registry. The reason why it's important to collect data on patients with a COVID-19 diagnosis, whether they have had surgery or not, is because this is a really valuable opportunity to gain insight and knowledge on a large scale about a disease that currently little is known about. So although the American College of Surgeons and the programs that we're usually collecting data on kind of revolve around surgery, in this case, the registry revolves around the diagnosis, which is new for some of us, but very important because of kind of the new nature of the crisis that we're currently facing. Participating in the ACS NISQIP program has absolutely helped our quality program as we have tried to navigate the COVID-19 pandemic. I would say to my fellow SCRs that the skills that we have and are able to leverage based on our experience with chart abstraction and review for those surgical patients absolutely aligns with our opportunity to collect data and share this meaningful information on the COVID-19 patients. Our experience has been that the ACS COVID-19 registry has a data entry portal that's very easy to navigate. It has a logical flow. The ACS has provided very helpful resources. I would also encourage my fellow SCRs to advocate for the ACS COVID-19 registry at your own institution. I encourage you to stay inquisitive, to ask a lot of questions, and stay positive through this journey. And I would just also like to say thank you to our clinical colleagues out there that are taking care of the COVID-19 patients. I think this is just a tremendous opportunity for us in the quality realm to support the work that they're doing, and which that work is just nothing short of heroic. And I thank them from the bottom of my heart.